What is silent endometriosis?
Okay, so that's a great question. Silent endometriosis is basically endometriosis that you don't really have the typical symptoms of. The typical symptoms of endometriosis is probably number one is painful periods. Um, I think silent endometriosis a lot of times refers to women who are trying to get pregnant and they are unable to, and they've gone through the entire workup. Their tubes are open, uterus looks good, egg quality or egg count is good, semen analysis is good, and they just can't find why they can't get pregnant. And about 30, actually like 30 to 50% of women who have unexplained fertility is due to endometriosis that they have had no symptoms of. So unfortunately, the only way you can do that is to diagnose it with laparoscopy, because endometriosis is such an inflammatory disease of the pelvis. It can affect implantation of the embryo. It can also affect your egg quality, and it's just a hostile environment in the pelvis in general. So when you remove that disease, a lot of times you're able to get pregnant because you remove a lot of the inflammation and the inflammatory cytokines and IL-6 and all those other nasty things that your body how your body reacts to endometriosis. But I don't recommend often for people to just, oh, I can't get pregnant, everything's good. So, I don't recommend let's go have surgery unless it depends. Sometimes I will, and sometimes it just kind of depends on the situation. But that's, I think, what most people refer to as silent endometriosis, just endometriosis that you don't have any symptoms of, and maybe the only symptom is infertility.
So a lot of these patients, I end up talking to them really early and telling them about how infertility can affect endometriosis. So even when a patient's like 17 and comes in and says, I have painful periods, and whether they've been diagnosed or not, I always talk to patients about fertility and discuss AMH levels and whether they want to get their ovarian reserve numbers checked earlier. So, I think if they had that when they were, let's say, 35, 40, trying to get pregnant, and they had numbers from when they were, 25, they could see the trend. But yeah, essentially we see a lot of that silent endometriosis, or when they're now doing infertility treatments and they're doing all the injections to stimulate fertility or ovulation. Now they're presenting with pain, and now they actually have to be worked up for endometriosis and possibly have that laparoscopy.
What would make one person's endometriosis be silent and one more expressive and symptomatic? Is that where multiple factors come in and it's hard to really?
That's a great question. I don't have an answer. If someone can figure that out, I think we just hit the jackpot. I have no idea why some people, like I said, have stage 4 and they're totally fine and no symptoms. Yeah. And then other people have maybe just very minimal peritoneal disease, not deeply invasive, and just have and are debilitated because of it.